Scott again. I'm going to demonstrate a mini bag. I'm in the med room and I'm going to check the doctor's orders. I'm going to check allergies and lab values, and today the doctor has ordered Rocephin, which is an anti-infective and it binds to the cell wall causing death. And contraindications are allergies to cephalosporins with side effects of nausea, vomiting, and rash. And I would look at the renal labs, which are the bun and creatinine. A normal dose is 1 to 2 grams per 12 to 24 hours, and I would watch for anaphylaxis and infection. So I did my calculation, which is right here. So I am going to draw my meds. I'm going to check the date to make sure that it is in date, which it is, and I'm going to clean the top. And I'm going to take my needle and draw up air for the dosage amount, and I'm going to inject it. And inject the air. I'm going to draw up the same amount of meds. And I'm going to take my bag and I am going to inject it, making sure that I don't puncture the bag. I'm going to inject the meds. I'm going to put my needle in the sharps container. I am going to label my bag with the drug, the patient, the date, the time, the dose, route, initials, anything that is relevant to the medication. And I am going to set my tubing up. And I'm going to label my tubing also with the date, time, and initials. And I am going to prime the tubing by squeezing this, making sure the medication goes throughout the tube. And I'm going to close the roll clamp. And I am going to also bring with me some pre-filled syringes full of saline. And I am going to go to the patient's room. So I'm going to knock on the door. Hi, it's Dot. I'm going to be your nurse today, and the doctor has ordered some medication to run through your IV. So I am going to pretend that didn't happen. I'm going to wash my hands, and I am going to put on some gloves, and I'm going to ask the patient to ID themselves. So I'm going to ask them to give me their name and date of birth, and I'm going to compare it to their armband. And in this case, it's the right patient, so I am going to get ready to start their fluids. I am going to palpate their IV site to check for redness, edema, pain, infiltration, which is cool, wet, and pale. And I'm going to clean the port site with alcohol swab, get my pre-filled saline syringe, and flush the site. I'm going to flush it with the push-stop method, and with positive pressure I'm going to clamp it. And so that's ready. I'm going to take my medication and hang it. Make sure there's no air in my tube. And I am going to connect the tubing and make sure this is unclamped so that it can run through. I'm going to set my drip rate with my roll clamp to the calculation that I previously did. And I am going to take off my gloves and wash my hands, and I am going to check on the patient periodically to make sure that it's not infiltrating or anything's wrong with it. And when it's done, I am going to come back in and I am going to disconnect the site. First, I'm going to come in the room, wash my hands, and put on more gloves. ID the patient again. And I'm going to disconnect the site. And I'm going to take my pre-filled saline syringe and I'm going to clean it, attach it, flush it with the push stop method. With positive pressure, I'm going to clamp the site and disconnect the saline. And I'm going to monitor the site periodically. And when I leave, I am going to document. I'm going to document the date, the time, the medication, the route, the dose, the site, record the volumes and the meds and the condition and the ins and outs. And I am going to, that's it, I think.